Hello, hola, Marco. So, I've lost about 330 pounds. That's like two people. Damn. I don't believe in myself sometimes. I really don't. I am currently in the 220s. I'm hitting a bit of a plateau. My goal weight's 220, and I'm thinking of dropping it to 200. But right now, I'm fluctuating between 223, 224, 226, up and down. I expect to hit 220 sometime this month, though. And I gotta say, the quality of my life has shot up. It's great, okay? I can squat, I can run, I can jump rope, I can do jumping jacks, I can do mountain climbers. That's awesome. That's great. It feels great. However, however, I have lost about two people's worth of mass, and my skin has not caught up. I currently wear a compression shirt almost all the time now. And the reason for that is because all this excess skin is beginning to get irritating as well as embarrassing. Now, I have some pictures for you. And I warn you, these are not for the faint of heart. I don't like them, but I want to give you some context as to what I mean here. So, here is a picture side view of me. This is my right arm. This is my left arm. And these are my thighs. Yeah, it's time. I gotta find a plastic surgeon. It's not something that's really useful. I kind of need to do this. Here's the thing, okay? Again, my arms will sometimes rub, especially if I'm not wearing a compression shirt. My arms rub, my man boobs definitely rub, my stomach will rub, and it doesn't hurt, it's just irritating. But also, things will pinch. Like, if I'm lying on my back, sometimes my skin will fold over, and that'll pinch, that's annoying. Even when I'm sitting down, the excess skin in my butt will fold over. That's also is irritating, sometimes a little painful even. And besides the physical discomfort that I'm experiencing, the embarrassment. Like, if I'm not wearing a compression shirt, then my man boobs will flop and slap my chest. My stomach will slap my abdomen. My arms will slap the side of my body. And that's just embarrassing. As I'm running or jumping or what have you, I'm hearing, that's just embarrassing. And it instills a sense of shame and a sense of, I don't like myself. And I really want to get away from the self-loathing I've had for years. I really want to get away from that. So the quality of my life is mitigated by these irritations that I'm having and the shame that comes along from just having this excess skin that's, embarrassing whenever I'm trying to be active. It hinders my ability to be active because I don't want to do jumping jacks or running if I know I'm going to be making all this other funny noises. And so again, I'm wearing a compression shirt almost all the time now. So it's time. It's time. I need to find a plastic surgeon. So I did a little research. Actually, I did a lot of research. Well, okay, I'm not sure. I did some research. Okay? Before, I kind of casually looked into it, but now I really want to look into it. I really took a much greater interest into the various aspects of what I'm going to need to get this plastic surgery done. Actually, I didn't know what I didn't know. For example, what am I looking for exactly? Okay, besides my arms, my thighs, my chest, I also want to get rid of this little waddle thing. Okay, I want to get rid of that. So what surgeries am I looking for? What am I asking for? Am I asking for a tummy tuck? Am I asking for whatever the surgery is that takes care of this? I don't know. So I looked into it, and apparently what I'm looking for is referred to as a body lift surgery. I have some notes. Okay. So bodiless surgery. Where is it? Okay. Bodiless surgery is a comprehensive cosmetic procedure that removes excess skin and tissue from multiple areas of the body, typically performed on patients who have experienced significant weight loss, like I have. It's also called a circumferential body lift or lower body lift. So, the surgeon or the surgery addresses loose, sagging skin that often remains after major weight loss from bariatric surgery, diet and exercise, or other causes. The procedure typically targets the abdomen, the buttocks, the hips, the thighs, and sometimes the back in a single operation, which I found kind of amazing. All that in one operation. I thought I would have to have multiple operations. I'm not quite sure how I feel about that because, having one operation, having to recover from that seems a bit more convenient than doing the arms, recovering from that, and then doing the legs, recovering from that, and then doing the stomach, recovering from that. But losing all that in one go, I'm not sure. I don't know. I have some concerns, which is why I have some questions for the doctor, but I'll get that in a second. Okay, so during the surgery, the surgeon makes incisions around the torso and removes excess skin and fat tissue. The remaining skin is then tightened and repositioned to create more contoured appearance. The incision usually goes around the entire circumference of the lower torso, which is why it's called a circumferential lift. Common areas, again, abdomen, lower back and flanks, buttocks and outer thighs, inner thighs sometimes. The procedure usually or typically takes 4 to 6 hours, which is wow, and requires general anesthesia. Recoveries involve several weeks of limited activity, and patients usually need to take time off work. I'm not too sure about me. I work weekend night shift, so I don't work 5 days a week, but I don't know. Again, more questions I'm gonna ask. Scarring is significant since the incision wraps around the body, though surgeons try to place them where they can be hidden by clothing. Bodily surgery carries the typical risks of major surgery, including infection, bleeding, scarring, and complications from anesthesia. It's generally recommended only for patients who have maintained stable weight for at least 6 to 12 months and are in good overall health. Now, I did talk to my primary care physician, and she gave me a check over, and she did give me a referral for plastic surgery. So I think I'm good to go there. Also, okay, so I'm looking for a bodiless surgery. Now I gotta find a plastic surgeon. And I did initially try and see where I might be able to go besides the US. Apparently Mexico is good, Colombia, Dominican Republic, Thailand, Turkey. Apparently also good places to go. But the place that has the highest plastic surgeries per capita is apparently South Korea. But they mostly do facial contouring as opposed to body contouring. I'm not really going to go abroad. But I was curious. The United States is apparently one of the better, if not best places to do plastic surgeries, but it's also among the most expensive, if not the most expensive, which is another thing I had to consider. So I live in Virginia, and apparently, from the research I did, it can cost as much as about $35,000. And I don't know how much, if any of it, the insurance will cover. Again, I want to find a doctor. I want to talk to the doctor first, see what advice the doctor can give me when talking to the insurance company, because I am going to have to talk to my insurance company and see what they cover, what they don't. I suspect that I'm going to be able to provide some kind of medical reasons for getting the surgery. So I don't think this will count, because this is not a medical needed, surgery. But again, I'm going to talk to doctors and see what I'm going to need to do, or see what I can do. So speaking of which, finding a doctor. According to the little research I did, or a lot of research I did, depending on your point of view, of course, you want to find a surgeon who is board certified by the American Board of Plastic Surgery. And there are apparently useful directories. There is the American Society of Plastic Surgeons website, there's the American Board of Plastic Surgery Verification Tool, and there's something called the U.S. News Directory of Plastic Surgeons. Now, I'm not looking for just any plastic surgeon. I'm not looking for a nose doctor or a faceless doctor. Again, I want somebody who is experienced with body contouring, specifically with somebody who's had bariatric surgery and has lost a lot of weight and has a lot of excess skin. So, things to look for, questions to ask. Let me see. Okay, how many body lift surgeries does the surgeon perform annually? Can I see any before and after pictures, particularly of patients who have a similar body type as me? What complications have you encountered? How do you handle them? And here's one I wasn't aware of. Here's one I was not aware of. What is your revision rate for body lift procedures? What's a revision rate? I didn't know what a revision rate was. Apparently, a revision rate refers to the percentage of patients who require additional surgery to correct or improve the results of their original body lift procedures, which is something I didn't even consider. So if the surgery goes well, then you may not need to come back to do some additional surgeries. However, it doesn't always go well, apparently. So a surgeon with a 5% revision rate means that 5 out of 100 people need to come back and do extra surgeries. Lower revision rates apparently are generally indicative of better surgical technique, more accurate patient selection, which again, I wasn't really thinking about. Like the doctor has to agree to do the surgery, of course. It indicates realistic expectation setting and better post-operative care. So why does it all matter? Okay, quality indicator. Lower revision rates often suggest better outcomes. Financial considerations. Revisions mean additional costs, though some surgeons include certain revisions in their fee, apparently. Recovery time. Of course, additional procedures mean more downtime. Risk assessment. Multiple surgeries carry cumulative risks. So, when a surgeon shares the revision rate, it demonstrates transparency about their outcomes. Great, awesome, I like that. However, according to my notes, be cautious. You want to be cautious of surgeons claiming extremely low rates, like 0 or 1%, as they might indicate they're not being fully transparent, since even excellent surgeons typically have some revision cases due to individual healing variations and the complexity of body lift surgery. Apparently, a reasonable revision rate for body lift surgery is typically in the 5 to 50% range, depending on the complexity of the case the surgery takes on. Okay, I didn't know that. Good to know. Good to know. So, what have I done specifically? Did I go to the American Society of Plastic Surgeons website? Did I check out the American Board of Plastic Surgery Verification Tool? Nope. I will. I plan on doing that, but the very first thing I did was go to people I knew and, for lack of a better phrase, felt knew more about it than I did. So basically, I went to my Pilates coach, I went to my personal trainer, I asked a couple of nurses I know, and I got back some referrals, and so I have made an appointment to see a doctor tomorrow. Now, I have a bunch of questions. I didn't even know what questions I should ask. I have like 20, 30, 40 questions. I have a lot of questions. And I'll put them in the description below. But me specifically, I want to know, has the doctor ever worked with somebody who's lost 300 plus pounds? I want to know about recovery time. How soon can I get back to CrossFit? How soon can I get back to yoga? How soon can I want to try boxing. I might want to try bouldering too. I want to know how long it can be before I can get back to exercise, which I find funny because I was never interested in exercise. Exercise is just tiring and hard, and every time you improve, the coaches just make things harder again. So I never really feel like I'm improving, because let's say I could begin with 10 squats and now I can do 30. So now they make me do 40. It's like However, the funny thing is, I go almost every day, not almost every day, okay? So Tuesday, Wednesday, Thursday on my days off, and Monday once and Friday. Okay, often, like 5 days a week, I go to CrossFit and then I go to yoga. On Wednesday, I meet with a personal trainer. So on that day, I go to CrossFit, I meet a personal trainer, and I go to yoga. I am working out way more than I ever have before. And I gotta say, I kind of like that I can do that. And I don't want to stop. I don't want to stall. I definitely don't want to stall. I definitely don't want to stop. So I'm very concerned about how long it's going to be before I can get back to that. I also want to chronicle this. I also want to put this on YouTube. I also want to show my results, show the process. So I need to ask the doctor, what issues the doctor may have with me chronicling this effort. Can I actually, maybe video the consultation or subsequent consultations? Because I'm not going to record the consultation I have tomorrow. So I have a bunch of questions. I have all the questions. I'm going to put them in the description below. And yeah, we're going to see how this first consultation goes. I am going to try and look for other, doctors to compare, contrast. I'm kind of, how do I put this? I'm kind of looking forward to, I don't know how to say this. I'm kind of looking forward to transforming, for lack of a better phrase. I know I did a lot of transforming already. Okay, I know I did a lot of changes, but I never really thought I would get this far. And I'm kind of looking forward to, for lack of a better phrase, finishing the race. I know I still have a lot to go, a long way to go. And even once I get to my goal weight and I get the surgeries done, from then, I want to improve. The way I think of it is that I'm in the negatives and I'm trying to get to zero. Okay? Once I get to zero, then I want to go up into the positives. Okay? I want to bench press 200, 225. I want to run a mile within whatever the appropriate amount of time is. I don't know when it is. Okay? I want to be able to do a pull-up. That's what I'm working on next with my trainer. And that's exciting. That's cool. What I'm not looking forward to is the expense and the pain. I know it's going to be painful. The bariatric surgery was painful. After surgery, I sat in the chair for 3 days. I'm not looking forward to that. I'm a little anxious about that. But I'm also like, I don't know how to say it. It feels like I'm earning the effort. I'm earning the effort to get to zero. So yeah, I have a consultation tomorrow, and when I'm done, I'll come back and I'll let you know how that goes. Until then, adios.